Joining us this morning to talk a little bit about the new mask mandates that have been released by the CDC, our favorite doctors in the whole wide world.
It's true.
Right?
It's
Friends
true.
of the show, all those other things we call them. True. Dr. Erin Philpott, Dr. Brad Greenberg from San Juan Regional Medical Center. Good morning. Good to both of you. Thank you for joining us.
Good morning. Thanks for having us again.
Thank you for being here, both of you. And so I guess first question to you, Dr. Greenberg. Let's start with you, if you don't mind, and that is talking about these new, mask mandates that we heard from the CDC that fully vaccinated folks do not necessarily have to wear their masks when they are outside, and maybe even in some larger indoor facilities. Can you talk a little bit about the changing, I guess, evidence that made the CDC change their guidelines?
Absolutely. And so I think that we should really be very, very happy that we have vaccines that work. There's been growing evidence that shows us that getting the vaccine really substantially reduces the risk of contracting COVID, of contracting severe COVID, and also likely reduces the viral load in those people that do happen to even be infected with COVID despite vaccination. And so what we've actually found is that, and what the CDC is embracing, is that the vaccines work, and they believe that those folks that have been vaccinated in non-healthcare settings can indeed relax some of those masking requirements. And so I think that's it's really reassuring. I think that it's super important that folks do pay attention to some of these details, though, and that this applies to vaccinated persons who are actually with other folks that are also vaccinated. Folks that still have that are not yet vaccinated, and we again strongly encourage people to go get whatever vaccine is available to them. Those folks still do have to pay attention to many of the stringent public health measures that were put into place to safeguard the public health. Those include masking and hand washing and social distancing, et cetera. So, but for now, I believe that those folks that have had vaccinations are indeed able to relax some of those elements. And they are really what they're saying is that indoor and outdoor activities really are minimally, they pose a minimal risk to people who are vaccinated. And those vaccinated folks have reduced risks of transmitting it. But, if they do have symptoms, we still strongly encourage, and so does the CDC, strongly encourage those folks to go get tested. So now, to be more detailed here, what the CDC has recommended is that folks who have been vaccinated can resume activities without wearing masks, except where it's required by a local or state or federal government, and that includes local businesses and workplaces. So folks still have to respect the rules of the establishments where they're going, the municipalities and states where they're going to also. And so folks who are fully vaccinated, resume domestic travel without testing requirements. And you can also refrain from testing after an exposure. And there are some exceptions for specific congregate settings, et cetera. And there's really no need to do routine screening testing if it's at all possible. So I think that there are some great relaxations here. This is all, again, a product of a vaccine that works. And we all have to do our part and get vaccinated so we can all enjoy these relaxation of restrictions, and we can continue with them moving forward.
Right. And I was going to follow up with you on that, Dr. Greenberg, about it really is all about the vaccine, because really the virus hasn't changed. It's still as infectious as ever. And the variants are, as we've talked on this program before, it really is to what the vaccine allows us to be able to do, correct?
Absolutely. I think, again, we are really fortunate to have vaccines that work. And so really this is a strong, strong message to anyone who is on the fence about getting vaccinated. Looks like there's really tangible things that could make your life easier after you get a vaccine. So get that vaccine and help all of us get back to something that looks and feels a little bit more like normal.
Great. And let's do a follow-up to Dr. Philpott. I have a question about still being able to transmit the virus. So what is going on there? Is there a viral load difference? Can vaccinated people still transmit the virus? It's just at a much lower probability? Or what is happening in the science there?
Yeah, that's a great question, Megan, and that's absolutely the first thing that came to my mind when this release from the CDC came out. We're obviously in a unique situation here, setting here in the hospital, and are swabbing everyone who comes in. So we have seen, not a small percent of people who have been vaccinated require hospitalization related to COVID. But generally, those with active symptomatic infection in the hospital are not vaccinated. Because we're swabbing everyone who's admitted to the hospital for our rigorous infection control precautions, we're picking up some post-vaccinated people that are positive. And this is in line with the studies. There have been 3 major studies that the CDC references in their sort of scientific brief, providing a background on the new masking policy, or the ability of vaccinated individuals to take their mask off, as Dr. Greenberg discussed. And these have shown that the vaccines, the Pfizer, the Moderna, mainly to date, have decreased, significantly reduced asymptomatic transmission, though have not eliminated it. So we still have a little bit of a data void zone where we are not certain about the transmissibility of these asymptomatic positive people post-vaccination. You're absolutely right, or alluded to, that they found the viral load among those vaccinated who do test positive. It's called a CT value, or a cycle threshold in the virology world. Is actually lower. The viral load is lower among those vaccinated. So possibly less likely to transmit, but still a little bit of a gray area there. So as you can imagine, if you are a vaccinated individual like myself who goes home to an unvaccinated household of children, I still remain somewhat concerned about the possibility of picking it up if I take my mask off everywhere I go and bringing it home. So I've made the personal decision to still wear a mask just for that reason. So until we have a little bit more data on that front. And then the effectiveness, so the efficacy is defined as how effective the vaccine is in studies, and that the effectiveness is kind of the real world information of how the vaccine is effective, how effective it is against symptomatic or asymptomatic, which I just outlined. The effectiveness against symptomatic disease is quite high. There's about 7 studies to date, also outlined sort of in this scientific background of the CDC guidance, that shows mainly in the high 80s to 90% in preventing symptomatic disease. High, and I believe both of the Pfizer and Moderna showed 100% efficacy in preventing severe disease. There was recently M&M, a morbidity and mortality, that was actually, I think just yesterday on 5/25, showing that 123 million people have been vaccinated in the United States, and there have been 10,262 vaccine breakthrough infections. Of those, 27% were asymptomatic, and then 10% were hospitalized. Of those 10%, and these are the cases I mentioned, people coming in for other things like urinary tract infection or pancreatitis, testing positive. So of the 10%, 29% had no symptoms, and then 2% have died. So I think that's gives us a pretty good sense. These vaccines really, really work. But, the risk isn't eliminated entirely of that, of asymptomatic or symptomatic infection.
Right. But that's true of almost anything, Dr. Philpott, right? I mean, there's an inherent risk to just crossing the street, for heaven's sakes. So
yeah.
That's what I had to say.
Especially the streets that don't have stoplights anymore.
The streets that are flashing, be careful. Yes.
So
Megan?
we have not we haven't talked about this, the surface, the question on how long viruses stay on surfaces in a long time. People are still practicing wiping stuff down, et cetera, which, I mean, don't get me wrong, I'm actually pro that. They should have been wiping down surfaces after people touch keypads for a long time before this happened. But where's the science at now with that? How long does COVID stay on surfaces? Does it stay on surfaces anyway? Dr. Greenberg, let's go to you for that.
So the frequent cleaning associated with COVID has yielded one of my favorite terms from the entire pandemic, and that's what the CDC has described as hygiene theater. They basically have talked about how, as we work through the unknowns that we had with COVID, it was really unclear how long it lasted on surfaces or what fomite-based transmission. That's basically from any kind of surface or object that someone could self-transfer by touching it and then touching a mucous membrane. We didn't really know what the likelihood was with COVID. And over time, it's really been demonstrated to be a very minor source of transmission. So I think it's important, though, that as we understand that it may be a very minor source of transmission, maintaining clean surfaces still remains something important that we should do, but it doesn't have to be done with the same fastidiousness or rigor that was emphasized earlier in the pandemic. We have at the hospital continued with cleaning protocols, but we've sort of relaxed them to basically make sure that we're keeping areas clean and paying special attention to rooms where we had folks that may have potentially had COVID. But those areas that are trafficked a whole lot less really get less, I would say, repeated cleaning. They still get routine cleaning, but repeated cleaning. So I think that it's okay for folks to feel, provided that they're washing their hands, careful not to touch mucous membranes, and wearing, if they choose to wear masks post-vaccinated in public settings, they can relax a little bit in I would say public environments, and can go back to more routine cleaning with standard kinds of soaps and disinfectants.
Understood. Thank you, Dr. Greenberg. And Dr. Philpott, I wanted to ask you about maybe looking forward as we live with COVID, because, I don't think we're talking about herd immunity as much anymore, but as more folks get vaccinated, as you both have suggested that they do, and the reasons why they should do it, because these vaccines are working. We have demonstrable facts that show that. Living with COVID, how do you think things are going to go? We're still going to be cleaning and surfaces and masking up where appropriate and things along that line. Where do you see ourselves this fall? Dr. Philpott?
Yeah, great question, Scott. I think it's difficult to predict, but I do have to say, I think we all sighed a breath of relief hearing about the advancement of the CDC's, public health policy with decreasing the rigor of mask using and putting it to the individuals more. But I think overall, I feel that if we can continue vaccinating and get the folks who have been waiting to not be the early adopters, but now 123 million people in, they aren't the early adopters. So as that continues to pick up, hopefully, things will start normalizing. And I'm really hopeful that we will get back to some semblance of a normal life. I think we all feel much more comfortable being with our older parents without a mask who've all been vaccinated, just those really basic human interactions and family dinners and those things we couldn't do last spring when this was all unfolding. So hoping for a normal fall, but there's always been surprises in store for us with COVID. So I think it's difficult to say. I think as we had discussed prior, our county has been vaccinated in a very heterogeneous way, meaning parts of the county are highly vaccinated and parts are not. And that's put us in a little bit of a unique position this spring as far as our numbers. So I think, again, there's so many factors, so many variables that makes predictions really challenging in these situations.
Of course. Dr. Greenberg, do you have anything to add?
I think that Dr. Philpott alluded to what's something I hope that everyone throughout the county does understand is that even though we are doing really well when it comes to vaccination across the county, the manner in which the vaccine sort of is across the population is skewed westward. And so I really hope that folks that are on the fence here really hear this and understand how important it is to go get vaccinated. And if it's okay, I'd like to just go through a couple different numbers to highlight how different it is from west to east. And I think that because across our county, we like to think that we're very well vaccinated. But in the city of Farmington, and this is all broken down by zip code by analysis from the Department of Health, we have vaccination rates of I would say full vaccination rates of only 50% and 42%. Then extending to Bloomfield, it's only 37%, and Aztec is only just under 32%. So I think westward we have vaccination rates that are like 100% in Kirtland and Shiprock and Waterflow. But I think that it's really important that we acknowledge that, even as our numbers look so good, in the last several weeks at the hospital, we've actually had another surge. We had a whole new surge of COVID inpatients, largely, as Dr. Philpott alluded to, of unvaccinated people. And so it's getting vaccinated is just such an important piece of trying to get out of this pandemic. And I think that it's very clear that a large swath of the population in those municipalities that I just mentioned still need to get vaccinated. And there's so many opportunities in our community to get that vaccine. I can't emphasize enough how important it is to do so. And that we, even as we're doing sort of like better from a numbers perspective across the whole county, we at the hospital are seeing the impacts of unvaccinated people who get sick with COVID. And we'd like to get out of this pandemic, and we're relying on every individual to make that choice to get vaccinated.
Yeah, very good reminder. Doctors, thank you as usual for joining us, sticking it out with us for this long.
Right.
That's a feat. So Dr. Erin Philpott and Brad Greenberg, thanks so much for joining us today.
Thanks so much.
Thanks for having us.
And there you go.